Veterinary medicine is more than appointments, charts, and long days. It's passion, it's pressure, it's purpose. Sit, Stay, Listen is a podcast dedicated to the conversations that matter most in veterinary medicine. Clinical insights, innovation, mental health, leadership, and the realities of life in this profession. Each episode features real voices from veterinarians, technicians, assistants, and receptionists sharing honest stories, lessons learned, and perspectives from the front lines. If you care for animals and care about the future of veterinary medicine, this space is for you. So take a moment, sit, stay, listen. Hi, welcome back to Sit, Stay, Listen. This week we're going to talk about specialty services offered in veterinary medicine. So examples would be radiology. So they read x-rays and ultrasounds, MRIs, CTs. Same thing they offer in humans. Not quite as many options, but the same. They read the images. There's neurology, cardiology, oncology. So for cancer patients, there's oncology units. There are criticalists. So I'm sure that some of our listeners have been to some of the ERs. They're 24 hours. Most of these are now corporate owned. But those are criticalists. So they go to school 4 more years to become ER doctors, essentially. So they are specialized in emergency medicine, which is great. So sometimes as a general practitioner, we'll send our patients to the ER because they are much more educated in that area. Dr. Lord?
Yeah, you also have some of the not so classic human equivalents. You got nutritionists, you have rehab specialists, acupuncture, chiropractic, behaviorists are super important.
Yes. A lot of people ask me what the difference between a veterinarian and a veterinary behaviorist is.
Well, I think the main difference is the behaviorists. I know behaviorists who aren't veterinarians, and they're basically, and I don't mean to be demeaning with this, but they're basically dog trainers who went the extra mile. They have a degree, so they are focused in behavior, the social aspect, the human aspect. And then, we have veterinary behaviorists who are doctors who focus on behavior. I think the most equivalent thing would be a psychologist and a psychiatrist.
Right. Yep, that's a good analogy. Mm-hmm. And then, of course, you have other specialties. So if you call me and ask me to see your chicken, no. I mean, they're not technically board certified specialists, but do people get board certified in large animal?
Yes and no. So I remember in school, I was really happy. I was really excited about cows. I love cows. And I went to my teacher and I said, I'm going to be a bovine internist. That sounds like something really cool that I want to do. And she looked at me and said, unless you're going to go into academia, that's not a thing. I love your passion though, but no. There are cow vets and then there are people doing research. And I think it's the same for any animal. I do know you need special licensing to work with chickens and pigs because of, the flu, honestly, and food. And then I think horse people are just horse people.
It's a whole nother subject. Yeah, she can be an equine specialist, although I don't think you have to have a board certification for that. There's dentistry, so that's another board certification.
I'm not entirely sure. I do remember that there are subsets, even just within GP, because you and I think we're both part of the small animal practitioners, club, I guess you could say. But in school, when I wanted to do cows, I had to be part of the American Bovine Association. I was part of FFA, I think. And then the horse people had their equine, and then the other farm animals had their own thing. The exotics people had their own thing. So that's...
But I don't think any of these are board certifications. There are definitely specialties, for sure. There's a clinic right down the road from us. We just do cats and dogs. There's a clinic right down the road that if you call about your iguana, I'm definitely sending you to that clinic.
Oh, 100%.
Yeah. But I don't think you have to have a board certification for that.
No, but I think those are the people that would do that thing, that middle ground that we sometimes have, where you have someone who really loves this thing. They're not quite board certified, but they're still a lot better than you and I are at that thing.
Mm-hmm. Yeah, that's true. Yeah. So, and why are these things important, right? It's important to have these specialties, just like in a human. Your GP can't do it all, right? It's because education has become so intricate and research is so intricate. We have to have these specialties because there's only so much the human mind can handle. I would love to be able to do it all, but I'm not that much of a genius.
I don't think any of us are. I was really contemplating this topic, and I think I really kind of boiled it down to three things. They have the toys that we don't have access to.
Yeah.
They have just the special focused education, because like I said, they focused on this for 4 extra years than we did. I can crack open a book and kind of figure it out, but they know how it works. And then experience. I see Addison's. I have 5 Addison's patients, and I think I'm doing a good job. But I call internists all the time who see tens, if not hundreds of Addison's cases. And I go, this is weird. And they go, oh yeah, that's atypical Addison's. I know what that is. You have one. Same thing, just a lot different. Good luck. And I'm like, can I transfer them to you? And they say, yes, of course you can. You can always transfer to us.
It's big. So one of the negatives of specialty is it's expensive. Just like we talked about the ERs. A lot of them are corporate. Some are not, but even the not corporate ones are still very expensive because it's hands-on care the whole time, right? And I think they don't understand the value of that, having your pet watched and having vital signs all the time. They're treating them like people in an ER or in the ICU, that kind of thing. So I don't think people, fully see the value in that or can afford it. Insurance obviously is a positive thing to have to be able to go see a specialist. Also internal medicine. I don't think we mentioned that one. You just touched on that.
Yeah. But internal medicine is a little different for us. We have nephrologists and pulmonologists and endocrinologists, and for us, that's internal medicine.
Yes, that's true. I remember some of the internal medicine specialists I went to Ohio State, and they would have specialties. So I remember us having a specific internal medicine nephrology teacher who did everything that had to do with kidneys. And then we had somebody else that had more experience with the liver, that kind of thing. But they were in research, so.
Oh, can't forget anesthesiologists. They're just as important too.
That's true.
Yeah.
Yes,
yeah. They get mad if we forgot about them.
Surgeons. There are board certified surgeons. They're very
That's true.
There are some surgeries that you don't want a general practitioner touching, like especially around the anus. If you've got some sort of anal thing going on, a mass, a prolapse, you really want a surgeon. You could call them a colorectal surgeon if you want, but they're just a surgeon. They do it all. And that's fascinating. I mean, obviously going through our surgery rotations was very fascinating to watch, but it was like, oh, wow.
So much fun. And that really does tie back into our last topic where, we have the surgeons now. The GP doesn't have to be the one to do all these things. And so I don't know about you, but I wasn't taught to do a lot. I was taught to do 3 surgeries and said, you'll figure out the rest on your own or you won't. Have fun. And then I said, thanks. And then I have a friend who's a board certified surgeon, and he had to go through some rigorous training to do some pretty impressive stuff that.
Yeah.
A good example would be skin flaps. I know how to do a skin flap. I will never do a skin flap because I don't know how to do a skin flap.
Well, the specifics, right? Yeah. So you have to know right where the blood supply is. You have to know how to find that to be able to use that skin flap. Because if you cut the wrong area or you kill off that supply, what was the point?
Mm-hmm.
And they also have, just like you were saying, ophthalmologist is another one. But just like you were saying, is surgeons and ophthalmologists both have very specific tools for what they're doing. And there's no way for a general practitioner to be able to perform those surgeries because those tools are extremely expensive, right? Like I remember if you wanted to remove a spleen without having to tie off every single vessel, you'd use something called a ligature. Mm-hmm. And it was 5 minutes and that spleen was out. Whereas, for me in a surgery, it could be 45 minutes, 30 minutes, an hour. But a ligature, I believe, is $15,000.
Yeah.
Well, thanks. But, and I'm sure the maintenance on it is costly, and I don't know how many parts have to be replaced or if it's a one and done. Like how many times can you use that specific ligature before it's done? I don't know the specifics on that, but it's a very expensive thing. That's why they charge so much.
You probably also have to get a specialty machine to clean it in the first place. So just the infrastructure around some of these things is crazy. And then the risk that you have with your staff and just an accident. Like I think a big reason a lot of these places have gone corporate is financial, because I know for a fact an endoscope is like 10 grand. And if you sneeze wrong and you break that fiber optic cable, it's
Hey. Hey. I brought the dogs to give it a real authentic feel, okay? Gosh. They're two Labradors. I guess I can show them off on our podcast.
Yeah.
It's Bo and Wally. They can be our little mascots. Hey, guys.
They should sit, stay, and listen.
They should. They do sit most of the time. Right now, they wanted to give their input. So yeah, so those, it does become cost prohibitive, but the value, to talk about the specialties and their value it's there. I know they're expensive, but they are extremely valuable. Like you said, there are some of these things that we can do. Like I can perform a splenectomy that doesn't require a specialist, but it takes longer. If there is a need for a blood transfusion, you're going to need, like usually surgeons are in the same building as a criticalist for obvious reasons, right? Like surgery can go wrong and it's not the surgeon's fault. It's just things happen. So you want to have those people on board, especially a criticalist, because if the heart stops, you got a criticalist. If they need a blood transfusion, you have a criticalist. If the blood pressure drops, they have those opinions, which is great. That's what makes a specialty hospital so great. So if we already have a critical patient in general practice, it's nice to have that option to be able to send them down the road to have those specialists right there. So that pet's, what is it, morbidity? No, mortality. It's late. So that they have a better chance of survival.
100%. And then just the support that everyone else can give those places is just really better for outcomes. I do dentals all the time on elderly patients. It's this thing we do, and I monitor and I take care of the mouth and everything else. I had a patient, though, who went to a dentist at a specialty center, and that dentist did dental things, and an anesthesiologist focused on gas and pain control. And I can admit it, she had better outcomes with them than she did with me because they were faster, they were more focused on individual items, and honestly, they got her out and awake a lot faster than I would have been able to.
Probably smoother, yeah.
Mm-hmm. And all those things did great.
Yeah, there's only so much, as a general practitioner, I mean, in a day, I can see an internal medicine patient, a dermatology patient, that's another one, dermatology, a dermatology patient, a, laceration surgical patient. Like in a day, I can see all these things, and there's only so much time for me to be educated in each one of those areas. So if it is something more complicated, a specialist is really a much better option than a general practitioner winging it. And not that we wing everything. Most of the time we do get very well educated. It just takes a lot of phone calls to get there, right? Like, hey, criticalists, we got this issue. They can't come see you. What do we do? And they're very nice. That's another good thing about specialists is they're very nice to get on the phone with you, for the most part, and kind of walk you through it and help you get there.
Oh, 100%, 100%. I think one of the nicest doctors I ever talked to was a criticalist. These people know so much. They can take a dog, take them apart, put them back together again at the cellular level. And they're just the most chill people because they know everything. They plan for every eventuality. It's great.
Well, I'm sure a phone call is a lot easier to handle than the crashing dog that comes in at 2 o'clock in the morning. Yeah.
But I think also sometimes you have to go there, though. We're talking about how it's nice to go there because they're a little bit better than us. They have more experience, this, that, the other thing. But sometimes it also just comes down to they have things we don't. An excellent example of that is oncology. I don't have access to chemo drugs, period. Like that is just not something I can even touch, even if I think I know what I'm doing. CT machines, MRIs. I do things with ultrasound and x-ray best I can, even though I know an MRI would be better. But I don't have a giant magnet in the back room. That's going to be somebody with a bigger building than I have.
I've had clients ask me, can you do an MRI here? No. Wouldn't that be cool? It's a one-stop shop.
That'd be awesome.
Yeah. Well, $500,000 later, no thank you. That's the other thing. I think that in the next 10 years, people will have a more realistic expectation of their general practitioners as well, because it'll become more commonplace to send them to a specialist. As opposed to just, like, I know you have a patient that has, a mass here, and there's a lot of important things here. and this owner wants you to just do everything you can. And it's like, I mean, we've done everything that we can, like to surgically remove that, to, put the patient on chemotherapy. It's just not something that we're able to do.
And patients like that, as the GP, I go, okay, I know what has to be done. I know what I can do. I know what I'm willing to do. And I have a couple Hail Marys. And the Hail Marys are always just that. It's me going, I will try this, but something could go terribly wrong.
And I can't fix it.
Exactly. And if that's where we land, that's where we land. I remember there was a bunch of my older teachers. They could do everything within, the context of when they first got out. And they were just like, yeah, you were by yourself. You just figured it out, or you didn't. And things just unraveled. And now, at least with the specialist everywhere, I can get on the phone in the middle of surgery if something happens or something isn't quite right and say, hey, this situation, what do I do? And sometimes they walk you through it. Other times they go, you need to transfer to us, please. And they just are always really nice to have available, at least just on a professional level. Yeah, it's always fun too, because in our field, I'm not sure how it works in human med, because thankfully I've had very few health problems in my life. But a lot of the things that go to the specialists, as soon as they go, figured it out, go back to your GP, hand them this piece of paper. They're going to do this for the rest of your life. And we just follow their instructions, pivot on the fly when we need to. And it gets outpatient to us quite a bit after the fact. And we learn and we get better. But
a lot of that's internal medicine or oncology patients that don't have to have constant chemo. Like, this is what you're going to do to keep them comfortable. Internal medicine, I think, is the most common one, though. Irritable bowel disease, Addison's, Cushing's, diabetes. These are major, major diseases, and we do have to manage those things. And sometimes, so some of our labs will have the convenience of being able to call a specialist. Let's talk to an internal medicine specialist. That's how I learned how to manage Addison's, was every time I'd see one, okay, let me call an internist about your specific case, what specific drugs I should put, you on, how frequently, that kind of thing. And then now we've managed so many. So when I first started seeing a bunch of Addison's patients, I was fortunate enough to be able to call an internist and have them walk me through quite a few of those patients. And then I got my groove and learned a lot about Addison's and how to manage those patients. So now I don't have to call them for that. Diabetes is the same. The first 20 patients I had, it was like, let me call the internist. And of course, they're very kind to walk you through that. And then you just learn,
I think a big part of talking with them, learning from them too, is when you finally can't help anymore. Like, a big one is our cats that have diabetes and pancreatitis and hepatitis all at the same time. I can do my best. I'm not going to fix that likely. Who can fix that? An internist with an ICU. Sometimes.
Yeah, exactly. They got to go through the criticalists first, and then they got to go to the internal medicine to get them stable.
I guess will fix was kind of strong. They have the best chance, I guess, is the better way to put it.
Just like a human, sometimes it's not fixable and they pass away from their disease. So, and I think one thing that people do need to understand is medicine is biology. It's not like a car. You don't bring your same Ford to the Ford manufacturer and they fix it, or whatever, mechanic, and they fix it. Whereas the body is very different. That's why there are breed-specific diseases. There are small dog diseases, large dog diseases, and then breed-specific diseases, because they're all different. They're the same, but they're different. And so there's not a one-size-fits-all for every patient. And I think that's another realistic thing that people will have to kind of wrap their head around.
Yeah.
But I appreciate the specialists. I appreciate that they're
100%. I think my favorite specialists, if I can be, show some favoritism, are the ones at universities, just because they have the sharpest tools and the newest techniques. Like, I think,
and they're so excited.
Yeah, they're always excited. I think UC Davis is still the only place that's doing kidney transplants in cats. And then, you can go to a one-stop shop. You can go over to Wazoo, get your MRI and ultrasound and surgery all in the same day.
All the same day, yes. It's amazing. I actually sent a patient to WSU for a liver mass removal. And they had to, in a 24-hour span, this patient got a CT scan, and she had gallstones, she had a liver mass that was located on the right side of the liver, so it's right next to the pancreas, it's right next to the duodenum where all those tubes come in, right next to the gallbladder, and she also had bladder stones. And so she had, within that 24-hour span, she had that liver mass removed, which was like, she's a dachshund, so it was about the size of her head.
Oh,
And yeah, and then they removed her gallbladder. They took out the stones out of her bladder, and they had to remove part of the duodenum because the mass was stuck to it. But it went great, and that dog is doing great because they went to a university and had all that done all at the same time. And it's a group of doctors all focused on that one patient, and she did great. So yeah.
I think the last little bit that I always tell folks about and why I think a specialist would be good is I know I'm guilty of going for one too many Hail Marys. I feel for my clients a lot, and I'll fight. I will fight with them when they're ready to fight for as long as they want to fight. And I'm thinking about my patient. I'm trying to keep them comfortable. But I know that I'm always like, oh, there's one more thing we can try. There's one more thing we can do. Do you want to this, that, the other thing? And I feel like the specialists have seen things so often and they understand these diseases so well that they'll look at something and go, no, it's not much more to do.
Get a more honest, quick opinion. I do send people, even if, let's just say it's a neurologic issue, and I'm like, at least have the conversation with the neurologist. That's why I tell them just to get your foot in the door, talk to that neurologist. They're going to give you a realistic opinion of what they think is going on. They're still going to recommend an MRI and maybe a CSF tap, but at least go and see them because you're getting that specialist opinion, which is, to me, worth the however much you have to spend to get it, $200-300. I don't know what it is, but it's worth to have that because I can't give you that. I remember neurology, and I see quite a few neuro patients like geriatric vestibular syndrome, IVDD, these kind of things. Like, these are things that GPs can handle, and because you see them pretty frequently. But I just had a dog that was circling to the left. No nystagmus, no head tilt, just circling to the left. And I'm like, I remember this from neurology, but for me to narrow that down, you're really going to have to go see a neurologist because you do need an MRI of the brain, but they can give you the options of what this might be. And I don't remember, I'm seeing more of the routine things, not this random. It's the first time I graduated in 2012. Okay. It's the first time, it's 2026. That's the first time I've ever seen that. And I'm like, I'd have to go watch video. I mean, it's a lot of research, whereas you could just spend $300 and get all the information you need from, yeah. And that was the other thing I was thinking too, is that most of the time, just like you were talking about at university, they can do all those things very quickly. So I've told them, before, like, I can do this piece. Like, if you have a dog that's just not eating, it's losing weight, and you've done the blood work and you've done the x-rays, it's like, well, we can keep, doing these things that take 24 to 48 hours, or you can go to one place, have all the answers you need within a 8-hour span. And to me, that's worth it. That's where the value comes in, is that speed. Some patients need the speed. Some patients can, take your time.
Mm-hmm. Yeah, 100%. I had one recently who needed an ultrasound. I knew it needed an ultrasound. I wanted them to get an ultrasound. My ultrasound availability is 2 weeks out.
Yeah.
It needs it right now. Thankfully, I think they got somewhere that they can get one today. Hopefully it was today. And you'll just get that answer. And that's just because resources, knowledge, just availability in general. Unfortunately, GPs, we got to go as fast as we can. And sometimes that's pretty slow.
Yeah. And that, yes, exactly. It is. Sometimes it's really slow. Yeah. So invaluable. Dermatology, we see a lot of dermatology. I'd say that's about 50% of what I see. But I do remember a German Shepherd. I had tried the antibiotics, had done the skin scrapes, everything that a GP is supposed to do. And I was like, you got to go see a dermatologist. And they ended up figuring out it was allergic to its own staph on its skin. And so they had to give it vaccines. I didn't even know that existed. Like, that's amazing to me. That's amazing that they know that the research is there. But I would have never come up with that. I would have never known you can be allergic to your own bacteria. So that dog was treated for a long term for like 6, 8 weeks with Septiderm, and then it was given vaccines, and its skin finally resolved because it had been going on for 6 months.
Mm.
I think we'd even done biopsies, and it was like, I don't know what's going on. And who knew? So yeah, it's pretty valuable. It's a valuable service to have, but it's, I think they're going to become more and more like they're going to become more available. There'll be more of them. And I think it's going to have to be a standard. COVID, when COVID hit, we were asked to stop doing surgery, right? And so some veterinarians actually liked that. Some general practitioners liked not doing surgery because you leave that environment for so long, and then you have to go back and you're like, oh, okay, this is actually really stressful. You just forget, because as a general practitioner forever, we were just expected to do it all. Fluffy wasn't getting a specialist, regardless of whether they were in your area or you could afford them. That's the other thing, specialty services within your area. I'm from Alabama, and we would have to drive up to Auburn. When I was young, if you wanted anything specialty done, you had to go to the university. Now they're having ERs kind of pop up in the major cities, but they're not in rural areas. If you're in a rural area, it makes it very difficult. GPs are still expected to do it all. So I think it's a wonderful thing that we have specialties, and there'll be more and more, especially in cardio, I think. In cardiology, I about maybe 5-7 years ago, something like that, I remember patients, some of my clients were taking their pets to France for a mitral valve replacement, and now they're doing it in Florida.
Oh, wow. Okay. I didn't even know about that.
Yeah, by the way. It was $30,000 or something, $30 to $40,000 for them to go to France, have the surgery done. But patients were doing really well, and so now they're starting to do it in Florida. I think it's in Orlando, but I'd have to look that up.
I have some clients who will fly to Mexico anytime they have to have surgery for one of their dogs, because they said it's cheaper to fly and do it down there and then come back. Because specialty, thankfully or unthankfully, depending on your outlook, our field's pretty small, even worldwide. Like, a lot of the really cool stuff can be done by a lot of the specialists anywhere in the world.
If you're willing to travel, yeah, for sure. I do know that some of the clients here will go to Idaho because it's cheaper. And there are board certified, especially orthopedics. Orthopedics are very expensive here. But you can go just travel 12 hours that way, take your camper, expect to spend the weekend or a few days, and you spend about a third of what it costs here. But I haven't met a client that's been to Mexico. That's funny. I do know some people who the people go to Mexico for plastic surgery because it's cheaper, but so yeah, specialty is good. I like to refer, not all the time. I don't have to refer, I'm not referring, but it is very valuable.
Like 90% of my conversations with people, anything that's not a healthy dog or cat, comes down to, okay, I'm going to give you a roadmap. Don't panic. It's going to be a lot of info, but I'm going to do X, Y, Z. And if that doesn't work, I'm going to do A. And if A doesn't work, I'm going to do B. And then if B doesn't work, we're either going to do C, or I'm going to send you to someone much smarter than me to try to figure out why these things didn't work. Because a lot of the time, too, specialists don't want to do X, Y, Z, A, B. They want me to do that. They want to jump straight into the weird stuff.
Right. Yes. Let's just eliminate what a GP can do, especially oncology. They want you to find exactly what kind of the cancer it is. They want you to stage, and then they want you to refer. So they want you to have that ultrasound done, those x-rays done. And then, I don't know how they do lymph nodes. I mean, we obviously can't pinpoint all the lymph nodes because you need imaging for that. But they're definitely one that likes to have whatever we can do done.
I've had them kick things back to me too and be like, hey, do this before you send them back. Do that. Do this. My internist teacher, she yelled at us jokingly every year that we were there. She was like, do not call me until you've done a rectal on your patient. If you call me and you haven't done a rectal, I'm hanging up on you. Because they're serious. They're like, it's important for us to know and you can do it. So do it.
That's funny. I mean, it's true.
Yeah.
Like a dermatologist is the same. Have you done a skin scrape? Have you done a cytology? Have you, like what have you done? I did realize the other day that they would prefer us not do biopsies. They would prefer to do that themselves because they know exactly where one is to or where they need to biopsy. Just in short, you want to biopsy normal and abnormal, but they know exactly like, okay, this is a really good spot because of these crusts or this whatever, this hair loss. So I did learn that recently because the dermatologist told the client, well, if I had done this, it would have been more diagnostic. And I was like, what I do? Yeah.
And then you have some organs we just won't even touch. I will never do eyeball surgery. I'll never do spinal surgery. Oh, I can't go in the chest. That's the other thing too. I legally can't go into a chest.
Well, because we don't have a ventilator.
Exactly.
You kind of need a ventilator. What you gonna do? Breathe?
Yeah, just bag them.
Yeah, just bag them. I mean, I guess that's what they used to do. And I've had thoracic patients where we've had to like figure it out. But yeah, no. Like a diaphragmatic hernia. No thanks. Mm-mm. So essentially a hole in the diaphragm. You have your organs from your abdomen going up into your chest. And the animal typically is stable because it's plugging the hole, right? Well, if you get in there and start unplugging that hole, boop, your lungs are all collapsed. So yeah, no, I'm not touching a diaphragmatic hernia. I had a criticalist, so I went into a surgery thinking it was a intestinal blockage. That's what I was told. And I was doing surgery that day. And so I was like, okay, let's go ahead and get the foreign body out. I didn't look at the x-rays. Well, when you look at the x-rays, there's a whole bunch of organs way up here, but I didn't look because it's, the GP told me like, it's a blockage. And so I get in there and I'm like, where's the spleen? And I was like, where's the rest of the stomach? Why is this so hard to move? And then I realized that it was a diaphragmatic hernia. I called a criticalist and he was like, you need ... And I was like, you know what I'm going to do? I'm going to close it up and I'm going to send it your way.
Yep. I had something similar my first year out. There was a fish hook and I did everything right. I took the x-rays. I did the blood work. I prepped for surgery. It was all good. I'm like, okay, cool. I see the fish hook. It's lodged in the stomach. I can get that. I can be careful. Get in there, pull it out. No big deal. And by the time I got my patient open, it was through the stomach, going into the liver and penetrating one of the great vessels. So
you said, so it back up.
She was bleeding too much. I couldn't stop. So I got the hook out. I packed everything. And while I'm doing that, I'm calling a specialist. I'm like, hi, I need you to talk me through this right now. And then as soon as we were done, she survived as far as I know. She woke up. I gave her to mom and I said, you need to go to a hospital right now. And she lived there for the next few days.
Yep.
Because she needs eyes on her. And I'm a GP. I did my best, but I didn't have an ultrasound at the time. I didn't have an MRI. I don't know what important things in the liver were now damaged.
And plus that metal being in the liver and in that, probably, I don't know, the portal vein, whatever it was in, but we don't know what kind of metal it was either.
Exactly. It's just one of those unfortunate things that you need a specialist for, that you can wind yourself up. And I'm thankful that everything worked out the way it did. She wasn't doing well. I don't think she would have lasted much longer.
Yeah. If it's like jabbing a vessel. That's good though. That's good she's around. Good job. I know we get ourselves into some moments where we're like, oh yeah, it's good to have a good tech too, by the way. I'm gonna put in a good word for technicians. Like when I have a good technician and something happened, like unexpected happens in a surgery, because again, anatomy's different in every pet. You don't know what you're getting into once you go in. That's what an exploratory is, right? And then if something happens, if your tech is very quick about things, the survivability of that pet is very high. Whereas if you have a tech that's fumbling or doesn't know what they're doing. So good job technicians as well.
Oh yeah, they also have their own subspecialties. I remember at university, there were the radiology technicians, there were the surgery technicians, the anesthesia technicians. And I'd argue, in fact, I will say it's true, and you can take me to court about this, most like subspecialty technicians are better than students and first-year veterinarians because they just do their thing so much.
Well, you need like a criticalist. They're there to, let's just say, put a central vein in or something, but that technician has to know, what are you grabbing? How do you prep for that? you got to have everything ready for that criticalist, and you got to be able to grab it within 10 seconds, right? And so them being educated and knowing what they're doing and being able to have that dog prepared for that ER specialist it takes a team, right? Like, it's not just one person saving. So yeah, there are wonderful specialty technicians. But for me in GP, they're not specialty, but they're still very good, very well trained, very well educated. So invaluable there as well. So yeah, yay specialties.
Yes, specialty.
Anyway, well, yeah. So if we refer you to a specialist, don't think there's no value in that. Yes. If we say you need to go, you need to go. Oh, yeah. 99% of the time, very necessary. So.
Or I'll give you one of my Hail Marys.
Yeah. Cross your fingers and your toes.
Trying to think if we forgot anybody.
I don't know. They keep popping up in my head too. I'm trying to go through my rotations. And whoever heard on the list.
Did we mention ortho?
Well, they're surgeons, right? So I don't think we have that distinction. I don't think there's they do decide to specialize, but it's not like their residency is the same. They have to learn the orthopedics and the soft tissue. So we did talk about orthopedic surgeons. Like, I send people to Oregon State all the time for their orthopedic department, but they're still just board certified surgeons. So they do it all technically. But some of them will want to specialize. But if the soft tissue surgeon isn't there that day and a splenectomy walks in, I think they're still doing a splenectomy, as far as I'm aware.
We got so focused on treatment and everything else, we forgot about the pharmacologists, the pathologists, and all the paperwork.
That's true. Well, because you don't have a dog pharmacist, right? Like, you do have a pharmacologist teaching pharmacology in school. But it's not like I can refer you to a pharmacologist. That's not really a thing. I have to call the human pharmacist if I want information on a drug I'm using for a pet. Or maybe Chewy employs veterinary pharmacists, but I don't know that that's a specialty in pharmacy school yet. I think they're introducing some.
If I remember correctly, my pharmacology professor told me there were 7 veterinary pharmacologists in the country total.
Yes, pharmacologists, but they're the ones doing research and creating things like Galliprant and, Panaquil and things like that. I don't believe they're at CVS. You know what I'm saying?
No, not at all.
That's what I mean. So yes, technically, but you're not referring to a pharmacologist. Your people are benefiting from their creations for sure, like Librela. There's a lot like VetMedin. That's a wonderful example.
I love that.
These things are veterinary specific medications created by veterinary pharmacologists. Vet nutritionists. Let's talk about that real quick. Okay. So let's touch on nutrition just very briefly. We'll talk about this at another, but there are a lot of dog foods, right? And people get overwhelmed with all these choices. And of course, marketing is a wonderful tool. But the number one thing I tell people is you need to, whatever food you choose, I'm going to recommend the veterinary brands because they're made by a team of veterinarians. There's whole research facilities full of vet nutritionists formulating those dog foods. But if you're asking me about some random dog food that just came out the market, like Katherine Heigl's dog food, I'm not a fan of celebrities creating a dog food because it's their passion. Your passion is acting. That's why you're an actor, and you're very good at it. Stick to that shit. But when you're creating a dog food, you very well could be hurting those animals because you're not involving a vet nutritionist in the formulation of that. So to me, a vet nutritionist is extremely important, an extremely important specialty that should be better respected rather than your dog food bag having a wolf on it and it's saying high protein. Why do you think that that's good? Yeah. That's not necessarily a good thing.
It's so hard too when you have these things because veterinary nutrition, I know a lot about the body. I know how things affect the body. It's kind of what I do for a living. But when I was an undergrad, animal sciences, nutritionist off of animal science was the thing. But it was less how does it affect the body and more how does this affect production? How does this meet the standards? How can I manipulate the market, manipulate my feed to have the lowest cost with the highest output that I want? Now, this is specific for cows, obviously, but there are subsets of folks that focus on that aspect of it. And I feel like sometimes they get confused with veterinary nutritionists because veterinary nutritionists don't care about in and out as much as they care about how is it affecting the body in a negative or positive way.
Exactly. Yep. Yeah, we'll go into food another time, but that's another specialty I thought it's actually very, very valuable. So.
And then
Oh,
pathologists, anytime we send blood work to the lab, you're seeing specialists.
yes, absolutely. And actually, I'll tell people that, well, when we remove masses, we're sending those masses to a pathologist. When we do a fine needle aspirate on a mass to just figure out what it is, that's a pathologist. When you have, and to go even further than that, we send this mass out, it comes back as lymphoma or possibly a round cell tumor, but we don't know what kind it is. The pathologists have all these different tests that they can run, like immunohistochemistry or special staining. So that it's a very, very valuable specialty to really narrow down, especially if I'm going to refer you to an oncologist and you're interested in chemotherapy or radiation. I need that pathologist to give me the information because I'm not coming up with that. Yeah, you can't.
Let me just sniff it real hard. I'll figure out what it is.
Yeah. So yeah, pathology is a good one. That's true. Behind the scenes kind of specialty. Yeah. What make sure your dog live day to day. Yeah, for sure.
Oh, and theriogenologists. Okay, I think it's the last one I can think of.
That's true. Theriogenology is breeding, so we get a lot of Frenchie breeders, and you should be doing artificial insemination and C-sections. And really, to do a C-section, you want to have the progesterones run and the ultrasounds performed. So if you're a really serious breeder, a theriogenologist is really the specialist you need to be visiting. GPs can do their best, but we are not. I have met older veterinarians that are now in their 70s who have done some therio stuff, but it was like they hired other veterinarians to do the GP and they focused on that. So if you want to focus on that and sort of do your like apprentice essentially and really, really study it, you can kind of achieve a specialty in that. But that's not really common anymore. Most GPs are sticking to general practitioner stuff, not really trying to specialize in one area.
And Therio is another good example of they have different toys. We have a robot that can run progesterone. It runs progesterone very well. However, the theriogenologists have a progesterone-only robot that is more sensitive, more specific, and is very just dialed in. And it's one of those things where we need a machine that can run everything because I see everything, whereas they can go, no, this is my little hormone machine. It tells me exactly this one thing. That's the only thing you're coming here for, which is appropriate. But that's over there, not over here.
Exactly. Yeah. I wouldn't go to a general practitioner in human medicine and want them to handle one getting pregnant plus like having the baby. That's why it's invaluable to have specialists. We accept that in human medicine. Pretty soon it's going to be a very accepted discipline in doggy medicine. Well, in dog and cat. And obviously in cows and horses, they already do that. Most of their breeding is done by a theriogenologist, especially if it's a high value animal.
Oh yeah, and they've got it down so far to a science that they can teach others how to do it too, to a point where it's practical, efficient, and working. And we're just not quite there yet with other things like orthopedics and internal medicine and neurology.
Yeah, well, you can do wet labs, right? Like you can go. I just sent half my staff to a dental continuing education course where they did wet labs. Yeah, so that was nice because you gotta stay up on it. We have a doctor that does some orthopedics, and he's gone to many, many wet labs to learn to do TPLOs, lateral sutures, patella repair, fracture repair.
I think it's another good example too of another reason why they're more advanced than we are. I have to, at least in this state, I have to do 32 hours of continuing education. I'll double check. But any sort of specialist has to do those base 32, and then they have extras on top for their specialty only. And I don't think they all cross over. I think some of them are here and some are there. So they also put in a lot more work to make sure they're on the up and up in what they're doing.
Yeah. Yeah. Although, granted, they probably have more time. I'll probably eat shit for that comment, but when an internal medicine appointment is 3 hours, and mine are every 15 to 20 minutes, they might have just slightly more time for that. But yeah, okay. Well, respect your specialists. 2 thumbs up for them all.
Yeah,
And the specialty technicians as well.
yeah, they're always worth the conversation.
Yeah. Okay, we'll catch you next time on Sit, Stay, Listen.
Bye-bye.
Thank you for spending time with Sit, Stay, Listen podcast. If you found today's conversation meaningful, be sure to subscribe, leave a review, or share the episode with someone. Until next time, take care of yourself and keep caring for those who depend on you.